Thank you so much for being a part of the LCSW Vibe Tribe. Yes, and I'm doing something special for you guys for Social Work Awareness Month. Yes, it is Social Work Month. We're in March. So I don't know when you're watching this video, but if you're watching it in March, we're offering an additional 10% off everything on our website. And check this out. We're doing free one-to-one strategy sessions for anybody that joins the course. In addition to the free coaching, it gets no better than that. I'm not trying to be funny, but it absolutely gets no better than that. We're going to give you everything you need to succeed. So tap in. Check the link in the bio. All right, guys, welcome back to LCSW Vibes. I'm so happy that you guys decided to join the channel. But nonetheless, let me introduce myself. My name is Ariza Hillman. I'm a licensed clinical social worker, and I have been helping people pass the LCSW and LMSW exam. So it doesn't matter whether you're a first timer or repeat test taker, this is the place to get the tools, the strategy, and the mindset you need so you can level up and pass this exam. So let's jump into it. Today, we're going to be talking about what types of questions you will see on the LCSW or the LMSW exam. Yes, everybody asks us, what kind of questions are there? Now, I'll let you know and I'll be honest with you. In my course, I do provide questions that are very, very, very close to what the exam questions are like. And some people might say, how can you do that? Because I've taken CEUs, I've taken courses, I've done some deep diving, I've done some training, I've done some course development, question development, all of that type of stuff to make sure that I'm able to give you what you need so you can be successful. However, for this purposes, I'm going to give you some types of questions, break it down, give you some strategies, all of this stuff. Some of you are getting ready to take the test now. You don't have time to be doing no course, so this is going to help you get to the finish line and do what you need to do. However, if you need the content and you need more support, that is what the course is for. But let's jump in. Let's talk about the types of questions that you're likely to see. The first one is a recall question. These test your ability to remember key concepts, key definitions, theories, and ethical principles. So an example here would be, what is the primary goal of cognitive behavioral therapy? If a test question, obviously is going to give you a little bit more meat, asks you something along those lines, it's not something for you to think and wonder about. You either know it or you don't know it. That is what I love about recall questions. There's not a large percentage of recall questions on the exam, but there are a few. And with recall questions, you either know it or you don't. Don't waste your time trying to see if the answer is going to come to you and you wishing upon a star and all this stuff. That's it. You either study, you know the content and you got it, or you don't. That is what I love about recall questions. The second type is application questions. These require you to apply your knowledge to real world scenarios. And these are pretty much my favorite because I love to give people scenarios and things to get their mind going and to help them think and to be able to see how they're able to apply this information to real life situations. This helps me help you so you can see that even though you're taking this exam and you're going over information, it's a reason for it. Sometimes we're like, why are they asking us this stuff? And that is the reason why. You want to be able to apply the information to real life or real world scenarios. So an example of that would be, say a client struggles with depression and they have some distorted thinking patterns. Which intervention would a CBT therapist most likely use first? I like that question. So let me say it to you again. A client with depression, they're struggling with distorted thinking patterns. Which intervention would a CBT therapist most likely use first? So in this question, I'm using it for example's sake, so we don't have A, B, or C. But in this question, you can see clearly this is a real life situation. You deal with clients that struggle with depression and they have a distorted way of thinking. So you would then look at the answer choices and understand which one is a CBT intervention. That is how you're going to rule out the other ones. If it's not a CBT intervention, then it's not what you're going to most likely use in this scenario because it's asking you what would a CBT therapist most likely use first. That is the key. So you must be able to hone in on some of those key concepts that are being asked and also be able to identify the stem in the question. And again, this is an application question. Let's move on to question type number 3. That is reasoning questions. These test your ability to analyze and make decisions based on best practices. So an example here would be a social worker receives a court subpoena for client records. What should they do first? So in this situation, you're testing your ability to analyze and make a decision based on what is the best thing to do. That is a reasoning question. In this example, the social worker is getting the subpoena, this subpoena right here. Well, let me get it. Maybe this is more like a subpoena. All right, this is the subpoena. And they're receiving that. What should they do first? The subpoena is requesting the client records. So this is when you would analyze and think about what is the best decision and the best practice scenario or circumstance in this case, and how would you proceed? That is a reasoning question. And normally you only hear there 3 questions. You have a recall question, you have an application question, you have a reasoning question. But I'm throwing in a 4th one for you guys today. Because what I always say, ethics first. So let's think about ethics-based questions. These are creeping up and they're everywhere on the exam. These assess your knowledge of the NASW Code of Ethics. They are questions that deal with confidentiality, professional boundaries, dual relationships, and so on. So an example would be a client tells a social worker they plan to harm someone. What is the social worker's best response? So it clearly is an ethical question. The client is stating they plan to do harm on someone else. What is the social worker's best response? That is when you're going to be thinking about, okay, the client confidentiality is at play because they're sharing something with me in a personal setting. Maybe you're in a therapy session. And also they plan to do harm to someone. So then you have that duty to warn. There's all these different concepts, but it's important to be able to understand that this is an ethic-based question. Sometimes if you're able to identify that it's an ethics-based question, you can put on your NASW ethics hat and think about how to respond and how to answer accordingly. So now let's move on to the second part of this training. You know, I did this part in 6 minutes. You know, I'm feeling myself. So I'm going to go ahead and throw in a little bonus part here. And we're going to talk about how to answer these exam questions using a strategy. The exam is designed to challenge your critical thinking, not just memorization. So here's some proven strategies that are going to help you choose the best answer. First, we're going to use the KISS method. So you guys have probably heard of the KISS method. We hear it all the time. Keep it simple, social worker. Yes, keep it simple, social worker. You like that, right? We want you to avoid overcomplicating the questions. So if you see multiple correct answers, pick the best first step rather than the long-term solutions. And I love for people to think on this level because sometimes we see answers and they all seem right. They're like, oh my God, I would do that. I would do that. I would do that. And I would do that. But you want to know, what do you do first? Like, we want to take immediate action right then and there. We don't want to worry about the long-term goal or the long-term solution. We want to just get in there and see what we can do quickly and efficiently to help this client and effectively so we can help this client succeed or get to that point that they're trying to get to. The second one is the first best next question strategy. So think about it like this. If the question asks for the first step, look for assessment related actions. Like if it's saying the first step, clearly we do assessments in the first stage, right? You guys have all finished the social work helping process. I think I did that video like a week or so ago. You guys have probably seen it. So that shows you, the assessment stage. That's the beginning stages. You building rapport, you build, doing the assessment, so forth. So if you see a question that's like first step, you want to look for assessment related type stuff. If it asks for the best response, choose the most ethical or the most client-centered approach. You feel me? So that is an easy way to look at it. You got the first, best, next. We're going to think first steps, assessment. If it's a best response, we want to look at what's most ethical, what is the most client-centered. And then if it asks, what do you do next? Consider what logically follows after the previous intervention. So when it says, what do you do next? You want to consider that you've already done something first. So logically, what would happen after you did that first step? That is how you want to think about it. You want to see what logically follows the previous intervention. All right. Third strategy, safety. Safety trumps everything. Safety trumps everything. So I even got an acronym for you guys, the safety acronym. You might want to write this down or take a screenshot of the picture here. I'm going to make sure it's written up there for you. Safety first. Assess for risk, call 911, duty to warn. Those are all the things you want to consider when you're doing the safety approach. The next is A, assess. Gather more information if no immediate danger is at hand. Then you have the F, feelings. You want to acknowledge and explore the emotions. What's going on with the client? What's taking place in the situation? Then E, empower. You want to look at client-centered solutions, strength-based approach. That is what we do as social workers. We want to empower our clients. And then you have T, the treatment. Refer only when necessary. You focus on direct interventions first, and if it's something that you're unable to do and it's out of your field or out of your expertise, then you would refer the client out to get treatment or assistance by someone else. And then after you hit the T, you got the Y. You stay in your lane. Why? Yes. Why? Why should we stay in our lane? Because we only take actions within our scope of practice. So always remember, guys, safety first. If you get a test question, you want to assess first for risk, call 911. You see the steps right here. Safety, assess, feelings, empower, treatment, and then why. You. The Y stands for you, which means you just basically stay in your lane because you only want to do things that you can do in your scope of practice. Hopefully this is helpful and you're understanding it. Let's move on to number 4. Eliminate wrong answers. Elimination technique. You guys are all familiar with it. You know it. I actually have a community, guys. And I'm going to make sure the link is in this description of the video, and it's also going to show up on your screen. But in this community, I actually have a free training, and it's actually teaching you pretty much more on this level of how to take the test and quick steps. And I got some nice PDFs that I threw in there to give you like a 30-day test prep, 30-day plan for taking the test, some common things that you do when test taking. So it's kind of elaboration of this, but it's going in a little bit more depth in areas, and it also provides you some PDFs that you can use as handouts. So make sure you take that free course, but the only way you're able to do that is if you join the community. But it's free. Free community, free course. So the only thing it's going to take is your time and a little bit of energy. And that's free if it's all going to help you take this test. So as we eliminate wrong answers, we want to do extreme language and make sure that we're not using it incorrectly. So let me back up. You want to avoid answers that include like always, never, must. Those are extreme language. We don't use that. If you see any of those things, you just want to eliminate it off the rip. Then you also want to have some things that you eliminate, which be ethical violations. They're always wrong. If an answer suggests breaking confidentiality without any legal justification, then the answer is wrong. And then this is a strategy that I have taught some of my supervisees over a period of time when they've had a difficult time trying to figure out how to pass the exam, how to answer these questions, and it's been a struggle. I told them, read the last sentence first. Sometimes the exam questions can be long. So skip to the last sentence first so you know exactly what they're asking before reading the whole vignette. That would let you know what you need to be focusing on in that vignette so you know how to answer the question. It's just a strategy. It doesn't work for everyone, but just keep it in mind. These are things that could work for you. So now that you have these strategies, you utilize them during your test prep journey. So when you're taking a quiz and you're taking practice tests and all those different things, you have to do lots of that. You want to make sure you use some of these techniques to decide whether they work for you or whether they don't. So keep that in mind, reading the last sentence first. All right, last but not least, prioritize ethical questions over your personal beliefs. This can be really tough. A lot of times people are taking this test and they're thinking about it from their job. Oh, at my job, we do this. Oh, my supervisor told me this. Oh, this person told me this. Oh, this, this. I get it. But you need to prioritize ethical practice over your personal beliefs or things that people have told you. The exam wants you to respond as neutral and as professional as you can as a social worker. So not based on your personal values or someone else's personal values. You have to be neutral when you're making these decisions. All right, so let me go ahead and give you a question just to see if you can kind of break this down and if it makes sense and all that good stuff. All right, here we go. A social worker is working with a client experiencing domestic violence. The client says that they are afraid to leave, but do not want to have police involved. What is the social worker's best response? A, call the police to ensure the client's safety. B, encourage the client to leave immediately. C, explore the client's fears and provide safety planning. D, insist the client report the abuse. What are you thinking? Come on. going to put this question right here on the screen for you so you can look at it and kind of think about it for a little bit and decide what would you do first. And let me know what method you use in the chat. It might be a simple question and you know it, but I still want you to get comfortable using a strategy. What did you decide to use? Did you use the elimination strategy? Did you use the ethical practice over personal beliefs? Did you use elimination of the wrong answers? Did you use a safety acronym? Like, just tell me what you did to get the answer. That'd be helpful. Put that in the chat. All right. The correct answer is C. Explore the client's fears and provide safety planning. A and D are not correct, which was call the police or insist that the client report the abuse, because you're violating self-determination. Yes, guys, self-determination. That is a word that you are definitely going to see over and over and over again in your social work career. The only time you violate self-determination is if immediate danger exists. If that client's at risk of hurting themselves or hurting someone else. But in this case, that was not the case. They weren't hurting anyone, and no one was actually, well, they weren't hurting themselves and they didn't have a plan to hurt anyone else. So that is why we want to alleviate that part. All right. And then it also was not B, because B assumes that they were ready. And without assessing the client's stage of change, we don't know if they're ready or not. So that is something we have to consider. So the correct answer here would be C, which is explore the client feelings and provide safety planning. I hope this video was hella helpful, guys. The LMSW and the LCSW exam is not just about memorizing terms. It's about knowing how to think like a social worker. That means using strategy, ethical reasoning, prioritizing client care, all of these things. So if you found this video to be helpful, I want you to drop in the comment section below and let me know what you want. If you need more breakdown of these questions, if you found it to be helpful, if you want, just maybe spend some time. Maybe I can do a live and run through some questions and kind of get you guys to chime in and take the questions and do all that good stuff. I'm open to suggestions. Just let me know what's going to work for you guys. And don't forget to what? Yes, you already know it. I'm not even going to say it anymore. And if you want the link to the course or the link to the free community, it is in the description category. And to the next one, you guys have an amazing day and make sure you do so on purpose.